Integrated Child Development Service Program. An overall comprehensive overview about this program is what we are going to speak about this. Overview of ICDS program is established in 1975 as a flagship program of Government of India. The target groups includes children under 6 years, pregnant women, lactating women and adults and girls. So focus on holistic development of children under 6 years associated with the pregnant and lactating mothers. Objective mainly focus upon improve nutritional and health status of children, lay a foundation for proper psychological, physical and social development, reduce child mortality, morbidity, malnutrition and school dropouts, to promote safe of motherhood. And how service have been provided? It is by the Anganwadi workers and the ANMs. And service provided are supplementary nutrition, immunization, health checkups and referral services, preschool or non-formal education, nutrition and healthcare education. Strengths and achievements. Widespread coverage over 1.4 million Asha Anganwadi workers across India, reaching rural and underserved areas. Integrating services with the combines nutrition, health, education or holistic child development. So they focus about the holistic child development. It can be about the food what they eat, their health conditions, and the educations happening connected with the school and Anganwadi. And focusing on early childhood developments promotes cognitive and social development. Empowerment of women, providing employment opportunity for women as ASHA workers, helpers, or different kind of roles what they could help in. Improvement in indicators as enhanced immunization coverage, reduced malnutrition, better health awareness. What are the weakness and limitations of this program? First one is inadequate infrastructure. Many ASHA workers and Anganwadi workers lack basic facilities. Funding issues as insufficient and irregular funding affects the service and deliveries because they all have their own incentives to be pumped on a monthly basis. When that amount or their salaries or incentives doesn't reach on time, so for them to buy the things and to provide the children with the enough and adequate nutrition doesn't happen. Variable quality of services, inconsistent standards in nutrition and education, undertrained workforce. Let it be the ASHA workers, the Anganwadi workers. So they have to be often trained at correct interval time for the continuous education purpose as updations. When it does not happen, they often lack adequate training and support. Weak monitoring base as insufficient monitoring and evaluation system. When a system is started, you need to have a monitoring way and you need to keep evaluating the system to know about how is it happening, how to improve a program. That doesn't happen from the side. Challenges and implementation. One is the geographical and social economical disparities, variation in infrastructure and resources. Every single state in India doesn't belong the same way. Every single district doesn't be on the same way. So, and there would be a riverside or a place which is planned. There would be a seaside. Maybe the other place would be hilly side. So each place will have to have each different type of challenges and they'll have different socio-economic disparities also from rural and urban cities. So those has to be very well noted and addressed. Cultural barriers as arrested due to different traditional practice. Coordination issues as lack of effective interdepartmental coordinations. Let it be from the fund side, let it be from the nutrition and the food side, from the education, correct control and evaluation side. So all this has to work on coordination basis. Bureaucratic delays as administrative inefficiencies and delays in fund allocations and in different conditions would also affect the program. Impact and effectiveness. Mixed result, improvement in child mortality and immunization, but slow progress in reducing malnutrition. Regional variations, success varies widely by state, influenced by local governance and resources. As we spoke about in the challenges and conditions, how was the bureaucrat getting involved? How was the government and the political influences being effectful in the each programs and in each keen on these points, the development would be seen much more in such states. Recent reforms and innovations. Poshan Abhiyan focus on reducing malnutrition through improved service delivery. Technological integration. How technology is getting integrated with this. Use of digital tools for monitoring data collections. And in community initiatives, programs like Village Health and Nutrition Days. For local engagement. Quality improvement in ECE as enhanced focus on early childhood educations and its quality. Recommendations and improvements. First one is infrastructure investment, upgrade of facilities and resources at Anganwadis and the care centers and training and capacity building of Anganwadi workers and ensure a fair compensations incentives. Strengthening and monitoring, improve the data accuracy, accountability through better monitoring systems. Community engagement. So as foster greater community involvement in program activities and when it has been done. So it would always give us the sense of being together and improve the community and the child and healthcare points and their possibilities. Address regional disparities. Tailor interventions to specific regional needs. As we had discussed about different geographical areas, we need different type of interventions. Different socio-economic conditions for rural and urban cannot be treated in the same way. So tailor-made intervention has to be specified to seeing each area ka challenges and that should be addressed. So in the point of conclusion, the ICDS program is crucial for addressing child health and nutrition in India. While it has achieved notable success, our ongoing challenges and disparities need to be addressed. Strengthening infrastructure, enhancing workforce capacity, and improving monitoring systems are essential steps for maximizing programs' impact and ensuring the well-being of vulnerable populations.